And there we can start, Councillor Ellison.
Thank you very much, Jane. Okay, so, and welcome, ladies and gentlemen, to this extraordinary virtual meeting of the Rutland Health and Wellbeing Board, held today on Tuesday, the 20th of May, and commenced at 3 p.m. We have a series of routine agenda items just to go through. Welcome and apologies. Have we received any apologies, Jane?
Yes, Chair, we have received apologies from Dawn Godfrey, Deborah Stewart, Mike Sands, Simon Pizzi, Kevin Quinn and Ket Chudasama, but we have Joanne Clinton attending as Ket's representative.
Lovely, thank you very much. Number 2, any declarations of interest from anybody? No? Okay, fine, thank you very much. Number 3, any petitions, deputations and questions?
None received, Chair.
Thank you very much. Any questions with notice from members?
None received, Chair.
And any notice of motion from members?
None received, Chair.
Okay, so today is a single subject meeting looking at the Pharmaceutical Needs Assessment 2025, the pre-consultation draft. It had to be arranged today to fit in with the timings, and it's report number 55-2025. It was originated by Mike Sands, Director of Public Health for Leicestershire and Rutland, but it's been presented and owned, I think, by Amy Chamberlain, Senior Public Health Analyst. So I'm going to hand over now to Amy. So thank you very much.
Thank you. I'll just run you through a bit of a summary of what's included in the draft, if that's okay with the presentation.
Lovely, thank you.
I'll just share my screen. Let me know when it's coming through.
Yes, that's true. Thank you, Amy.
Perfect, thank you. So as I said, I'll just give a quick introduction to the PNA, and then I'll present some of the key themes and headlines that are coming out of the different sections of the document, and then open up for discussion. So the purpose of the Pharmaceutical Needs Assessment is to identify pharmaceutical services that are currently available and to assess the need for future services. This is to inform planning and commissioning and to inform decision making in response to new pharmacy applications made to the Integrated Care Board. There is a statutory requirement for the Health and Wellbeing Board to produce a PNA every 3 years, and the process of developing the PNA involves looking at the existing pharmacies, their locations, the range of services, that they are providing, and the views of the people who are using them. And the assessment covers a range of different services provided in relation to the health needs of the local population. This slide just kind of outlines some of the legislative background of the PNA. So the NHS Pharmaceutical Services and Local Pharmaceutical Services regulations from 2013 set out the legislative background for developing and updating the PNAs. The regulations require that a series of statements are covered within the PNA. And these include a statement of the pharmaceutical services that have been identified as necessary to meet the current or future need, the services that have or would secure improvements or better access, and also any other NHS services that affect the need for pharmaceutical services. You can see on the right there, the regulations also outline some other information that's to be included or taken into account within the document. And this includes information on the demography of the area and any localities that have been identified, as well as the provision of services in neighbouring areas, and also a report on the consultation that's taken place as part of the PNA development. So that's a bit of the background into the PNA. And if we now move on to the data that's included within the document. So these are some of the key health needs that have been highlighted in Rutland. So as we know, compared to nationally, Rutland has an older population and as such higher proportions of age-related long-term conditions. Rutland also has a larger military population, although it is noted that their primary care is provided by the Military of Defence rather than the NHS and community pharmacies. We know that Rutland is not particularly deprived, so we've got no residents living within the 40% most deprived areas nationally. And then in terms of life expectancy, for men and women in Rutland, life expectancy is significantly better than the England average. In terms of pharmacy provision in Rutland, so this is as of September 2024, and the map there shows the location and opening hours of pharmacies in Rutland, and also those within 1.6 kilometres of Rutland's boundary. So as of September 2024, Rutland has 6 pharmacies across Oakham and Uppingham, and this equates to 1.5 community pharmacies per 10,000 population. This is lower than the England average of 1.8, but is similar to the rate of pharmacies reported in the previous 2022 P&A. You can see on the right here that there are also 4 other pharmacies in Stamford, which are located within 1.6 kilometres of Rutland's boundary. And Rutland residents in the east of the county are likely to travel across the border to access these, which increases the number of pharmacies available to Rutland residents. In addition to the pharmacies, Rutland also has 3 dispensing GPs, which can dispense medicines and appliances to patients who live in a controlled locality or a rural area and are more than 1.6 kilometres away from a community pharmacy. So in Rutland, combining community pharmacies and dispensing GPs gives a better indication of the total population coverage for Rutland. And as of September 2024, Rutland has 2.2 pharmacies and dispensing GP locations per 10,000 population. And this is better than the average for England, which was 2.0 per 10,000 population. And again, is similar to the 2.2 reported in the 2022 Rutland P&A. All Rutland residents can drive to their nearest pharmacy or dispensing GP location within 20 minutes. Just under half can walk within 15 minutes, and around 60% can travel by public transport on a weekday morning within 15 minutes. The 6 pharmacies across Rutland, you can see on the map there, are open at varying times. It should be noted that these hours have reduced slightly when compared to the available opening times reported in the previous P&A, but they do still provide good coverage. And then finally to note, the ICB received notice that Pickford's pharmacy in Rutland, which is FD 852 there, closed on the 1st of March 2025, which has resulted in 5 pharmacies within Rutland. However, there is currently a pharmacy located on the same street as Pickford's pharmacy, and it does have similar opening times. So the closure is unlikely to impact residents' access or travel time to a pharmacy location. There are 4 different types of services covered in the P&A, and these are essential, advanced, locally commissioned and enhanced services. And I'll just quickly run through a bit of a definition and what each of these services are. So if we start with the essential services, these are services that are required to be offered by all pharmacies, all community pharmacies, as part of the community pharmacy contractual framework. And there are the 9 essential services listed there that you can see on the slide. And these are offered by all pharmacies in Rutland and include services like dispensing of medicines and appliances, disposal of unwanted medicines, the promotion of healthy lifestyles, and the discharge medicine service. If we move on to the advanced services, so there are currently 9 advanced services within the community pharmacy contractual framework, and pharmacy owners can actually choose to provide any of these services as long as they meet the requirements set out around issues such as premises and staff training. So you can see in the table here, this is the activity provided under the advanced services in Rutland pharmacies, and again, pharmacies within 1.6 kilometres of Rutland's boundary in 2023-24. And we can see that of the 6 pharmacies in Rutland, all 6 pharmacies provided activity under the Pharmacy First, the flu vaccination and the new medicine service. 5 pharmacies provided activity under the blood pressure or hypertension case finding service. 4 pharmacies provided activity under the lateral flow device service, and then just 1 pharmacy provided the pharmacy contraception service. And we can see here that no pharmacies in Rutland provided activity under the smoking cessation service, the appliance use review service, or the stoma customisation service. Despite there being no activity, though, for the smoking cessation service, 1 pharmacy in Rutland was signed up to provide this service in 2023-24. There just wasn't any activity under it. However, we don't have a data available to help us to understand whether the appliance use review or Stoma appliance customisation service were offered in Rutland or not. But Rutland residents in need of these services are able to access them via dispensing appliance contractors in other areas. And Stoma nurses employed by dispensing appliance contractors will also provide the services at the patient's home. If we consider the closure of Pickford's pharmacy in Oakham, we've deemed this will not significantly impact the range of advanced services available across Rutland, as the pharmacy, which is currently located on the same street, provided activity under the same services as Pickford's pharmacy in 2023-24, with the exception of the lateral flow device service. However, this lateral flow device service was provided by the other two pharmacies located in Oakham, one of which is a 2-minute walk away from the location of Pickford's pharmacy. So residents should not have to travel much further to access that service now that the Pickford's pharmacy is closed. As shown in the table here, there is further provision of advanced services available in the pharmacies in Stamford within 1.6 kilometres of Rutland's boundary. In terms of activity, changes in activity over time, we've seen an increasing trend in activity witnessed for the Pharmacy First service. So this service provides advice and NHS funded treatment for 7 common conditions. And there's also been an increasing trend in the activity for the pharmacy contraception service, and also the hypertension case finding service, which is the blood pressure check service. There was less activity under the flu vaccination service witnessed in 2023-24 than in the previous year of 2022-23. And for the new medicine service, which aims to improve medicine adherence in people with long-term conditions that have been prescribed a new medication, activity fluctuated over recent years for that service. So in addition to the nationally determined services, community pharmacies can also provide locally commissioned services, and these are commissioned by local authorities, ICBs and local NHS England teams to meet the specific health needs of the local population. So examples of this type of service include the emergency hormonal contraception service, substance use services, and then also a palliative medicine supply service. So in 2023-24, one pharmacy in Rutland provided activity under the emergency hormonal contraception service. In terms of the substance use services, in 23-24, one pharmacy in Rutland provided activity under the supervised consumption service. This service requires the pharmacist to supervise the consumption of methadone or other prescribed drugs in the pharmacy to ensure that the dose has been administered to the specific patient. And then over recent years, Rutland County Council have commissioned a needle exchange service through Turning Point, with activity that fluctuated between 2019-20 and 2022-23, but no pharmacies provided this needle exchange service, provided activity, under this needle exchange service in 2023-24. And then finally, between the 1st of October 2024 and the 17th of March 2025, there was one delivery of urgent end-of-life medication to Rutland under the urgent supply and home delivery of palliative care and specialised medicine service. If we move on to the enhanced services, so national enhanced services are nationally specified and commissioned by NHS England. And there are currently 2 national enhanced services commissioned, which are the COVID-19 vaccination service and then the RSV and pertussis vaccination service. In 2023-24, the COVID-19 vaccination service was provided by one pharmacy in Oakham, which provided 11,374 COVID-19 vaccinations. And then in terms of the RSV and pertussis vaccination service, NHS England has published an invitation to tender, inviting community pharmacy owners interested in providing this service to come forward, but there are currently no pharmacies within Rutland that are able to apply to participate in this service. So that kind of is an overview of the services that are provided by the pharmacies and included in the PNA. If we also had a look at the projected future needs of the Rutland population, So the ONS population projections suggest that the population of Rutland will grow by around 6.1% between 2025 and 2035, with a projected population of around 44,839 people in 2035. The largest projected growth in Rutland is in the older population groups, and the projected increase in the older population will likely lead to increases in the number of people living with age-related long-term conditions. In terms of housing developments, there are a further 1,189 dwellings required by 2041, with 89% of these currently planned across Stamford North, Oakham, and Uppingham, where the pharmaceutical provision across Rutland is current and its surrounding areas is currently at its highest. We also conducted 2 surveys as part of the P&A process. So these are currently preliminary results for the survey analysis. As for the public survey, we're still looking at some of the LLR-wide and qualitative results. And for the pharmacy contractor survey, this survey is still live in hopes of getting additional responses from pharmacies. So for the pharmacy contractor survey, the aim of this survey was to gain a better understanding of local pharmacy capacity, services provided and the facilities available within pharmacies. And between the 13th of February and the 7th of May, we had 43 responses to the professional survey from pharmacies located in Leicestershire and Rutland. So we have combined the data for Rutland and Leicestershire pharmacies due to the small number of responses from the pharmacies in Rutland. So in terms of the results from this survey, all respondents have a private consultation area on the premises that is appropriate for confidential consultations. A range of accessibility facilities are provided by pharmacies in Leicestershire and Rutland. 70% of respondents agreed that they felt able to maintain the current level of service. And when asked about the plans for their pharmacy business for the next year, 63% of respondents plan to continue in operating at the same level, whilst 28% plan to expand their business. Between 61% and 65% of respondents thought that the current provision of pharmacies within a 3-mile radius of their own pharmacy was good or excellent. And this was in terms of location, the number of pharmacies, and the range of pharmacy services provided. There were mixed experiences reported in the extent of difficulties in recruiting for the range of pharmacy roles. And finally, most respondents do not currently offer the NHS or private independent prescribing services. So we also conducted the public survey. The aim of this one was to gain views from the public on service provision, including the quality, location, opening hours, and accessibility of pharmacy services. And between February and May, we received 322 responses from people reported to be living in Rutland. Of these responses, 62% agreed that their pharmacy provides a good service, with only 4% disagreeing with this statement. Almost all respondents reported that it takes less than 30 minutes to travel to their usual pharmacy, with it taking less than 15 minutes in 71% of cases. And then finally, for the majority of respondents, the quality of the pharmacy service was very important, as was the availability of medication at the pharmacy and also the location of the pharmacy. And private areas to speak to a pharmacist were very important to around half of respondents. So if we move on to the gap analysis and conclusions of the Rutland P&A for 2025. So subject to the importance of continued community, voluntary and public transport provision, no gaps were identified in the provision of essential, advanced, enhanced or locally commissioned services across the Health and Wellbeing Board area. In terms of the conclusions, overall, it was concluded that pharmacies are meeting the current needs of the Rutland population. It was recognised that there are differences in the local provision across the county, and it may be that some residents in some areas have to travel further to access a particular service or outside of normal working hours. The level of activity provided has increased across most of the advanced services where activity was provided. And Rutland residents are generally happy with the pharmacy services that they're receiving. So finally, if we look at the recommendations from the report, So some of the recommendations are similar to those included in the previous P&A. So I'm not going to go through all of these, but they are included in the draft. I thought I'd just highlight some of the new recommendations that have been added for the 2025 P&A. So these include to monitor the impact of the closure of Pickford's pharmacy in Oakham, so that we can ensure that the remaining pharmacies can meet any change in demand for services, particularly with the noted projected growth in the population. To keep under review the timely access to medications and promote the wider use of private consultation rooms. We also noted to encourage pharmacies to offer locally commissioned services in relation to local need. To consider the opportunities that independent prescribing may offer to service delivery, and look to integrate independent prescribing where this is appropriate. We also noted that a recommendation to improve the available pharmaceutical data sets, particularly to enable the distinction between pharmacies that are signed up to provide services and those that did not provide activity under a specific service within a given time frame. To review evidence of the impact of recent policy and funding changes on services, to review and manage the impact of the increasing demand for pharmacy services, so particularly for the Pharmacy First service and the hypertension case finding or blood pressure check service. And then finally, to consider periodic reviews of the recommendations and progress on these to present to the Health and Wellbeing Board. So hopefully that gives you a good summary of the key themes from the 2025 Rutland P&A. The next step, once approved, is to put the draft out for consultation in June.
Amy, it's me again. I thought, from that we'd already been to consultation.
So we've put out two.
Go on, carry on.
We've been out for two services. So we have the public engagement survey and then the pharmacy professional survey. The consultation is more a consultation on the draft, which is a statutory 60-day consultation where we get responses from statutory bodies and then also the public or anyone else who feels they want to respond on the draft. Things like, does it accurately?
Yeah. So what is the point? So that's very rude. Is the point to find out what people actually think about pharmacy services in Rutland?
So that was the point of the public survey that we've already completed. Yeah.
So what's the point of the next one? Sorry, I need to explain this
to get their views on the draft P&A.
To just the paperwork, really. Have you put the paperwork together really well and nicely and accurately? Not
if we've provided an accurate picture of the provision.
Right. We need to be very careful about that, I think. I'm not sure because I can see Janet's face there, and Janet's going to say to me, aren't you, Janet? People aren't happy with the pharmacy, perhaps. Was that a fair comment, Janet?
No, I don't think it is a fair comment.
Okay.
We have received some comments in a project we did recently on communications. One of the adverse comments was the fact that people have their prescriptions sent electronically to pharmacists, but the pharmacists don't actually notify them when their prescription is ready for collection, has been dispensed and is ready for collection. And if they go and it's not being dispensed, then they feel that they're being told off for going too early. So they wondered whether the pharmacists could text message or use some sort of electronic form to actually notify patients that their prescription is ready for collection.
Yeah, stop there. Amy, did you cover that in part of your questionnaire and review? Or
no,
sorry.
No, that's not a question that we asked specifically. I haven't been through all of the qualitative responses. There were some open text boxes where the public could report any of the problems that they had with their pharmacies. So it may be that something like that is mentioned in there.
Right. It's just I'm trying to work out how to sell the next level of. Do we have to explain this to people? The next level of consultation, or will you take charge of it completely?
So we'll have a survey that goes out for the statutory 60-day consultation, which will ask people their views on the draft to ensure that they're happy that it's accurate.
Right. Okay. Do you want people's views here, or is that all you need to do today from us?
We need from you today approval to go out with this draft version for consultation.
Right. So let's see what. So are there comments from anybody? Anybody wants to come in? Because I've got a couple. Janet, you're back. Quick.
Yeah, thank you, Diane. One of the things I thought that, unless I missed it, because I confess to being a bit short on time this week, one of the things that I thought the draft would be better for is for those services that are not available in local pharmacies, i.e. stoma care and smoking cessation, whether there could be some mention of where or how those services could be achieved other than in the local pharmacies.
Okay, yeah. So the smoking one is provided by one pharmacy in Rutland, or I should say it's offered by one pharmacy in Rutland. There just wasn't any activity under that service in the 2023-24 time period. I think I have noted in the draft where the stoma and appliance use review services can be accessed otherwise, but I'll review that and make sure that we've got note of that.
Is there a reason why people haven't accessed smoking cessation in pharmacies? Do they not know about it, or can they get it somewhere else? Are they getting, or do they not just not want to smoke?
Go on.
So-
either you or me, Adrian, can jump on that point.
So yes, smoking services are delivered by Leicestershire on behalf of Rutland, and it's a digital stop smoking service. So pharmacotherapy is posted out to patients. So if you phoned and you were involved in the service, you would have that. You would have your supply of pharmacotherapy posted out to you. The reason why there's a pharmacy service linked to that is because some people, certainly in other parts of the country, want to either go to their local pharmacy to collect their pharmacotherapy, or there is a drug called varenicline, which is only prescribed via GP and pharmacy, but there hasn't been any prescriptions of that in the service for Leicestershire or Rutland, because that drug has been unavailable for about 18 months. So that's what, so the lack of activity isn't because there hasn't been anybody engaged in the service. It's just that there hasn't been anybody engaging with the pharmacy for the specific drugs that need to be prescribred.
Can I
If
jump
that
in?
gives you some assurance.
I'm sorry, David and Debs, but I'm going to go. Fran, do you want to come back and defend what we're doing here?
Me?
Yeah, you.
So we also have, it's worth me, I'm sure Adrian, well, you do know this, obviously. We have Kajal, who is our stop smoking specialist advisor, Janet, in Rutland. So she came on board with us in October last year, and she's making fantastic inroads across the armed forces and with different businesses across Rutland and members of the public and GP practices engaging people with the Quit Ready service. So that's proving really positive so far.
So that's not part of the pharmacy service, Janet.
No, no, this is separate.
And that's why it was really important that we get that bit clear.
Yeah.
Happy now, Janet?
I think so, for the time being.
Debs, you're on.
And Paul's got his hand up. I don't know if he wants to make a comment specifically on that. So it might be worthwhile.
Oh, if I could, there's a little bit of misconception around the stop smoking service as referred to in the PNA. The stop smoking service referred to in the PNA is regarding the National Community Pharmacy Contracted Advanced Service. The only way patients can access that service in the pharmacy is from a referral from an acute hospital trust, which in our case is predominantly UHL, although I appreciate across the border. It's not a walk-in service. It's not a referral service from general practice. It's not a public health service. It's to support patients who start NRT in hospital and are discharged on NRT in a service. It was tried in LLR from UHL, but UHL it didn't particularly work particularly well across LR, and UHL have no longer sending referrals to that service. So just to clarify exactly what that means in terms of PNA and the national and the service defined in the PNA, which is the National Pharmacy Service. Other stop smoking services are available for private care, but I just wanted to really clear that part up.
Paul, can I just clarify that will, and it will unlikely to ever happen
It could be revisited depending on lots of other factors,
right.
But I think in the short to medium term, the answer is no.
Okay, that's lovely. Thank you very much. Thank you, Paul. Debs, now do you want to jump in? Well spotted. He wasn't on my screen.
Okay, well, both Fran and Paul have picked up two of my points. My third one was just an overall thank you for the report and the presenting the findings. I think it's really clear. I think I'm certainly supportive of it going to the next stage. I think it gives a very clear position for the public and for organisations to respond on. So thank you.
Thanks, Debs. David, welcome. Would you like to say something?
Thank you very much. Yeah, just to say pretty much the same as Debs, that I think you've done a really thorough report. I think it's really clear. You've set out the opportunities, and taking that out to consultation, I think, makes complete sense.
Lovely. Thank you, David. Can I just, or Kim? No, yeah, Kim, you're flashing at me now.
So can I just clarify? I mean, again, Amy, excellent report and really thorough presentation with lots of detail. So thank you for that. Just one question. I think it was slide 11 on the survey. It said something, and it caught part of it. So it's just to clarify that that most would say they could maintain a current service, but a quarter said they couldn't. Is that? Have I read that right? Just to clarify, and if it was, what if that quarter couldn't? Why?
Yeah, so 70% respondents agree that they felt able to maintain the current level, and it was 26% that stated that they did not. Within the qualitative analysis, we'll have a look at any reasons why those pharmacies said that they couldn't maintain their current position.
Okay, that's useful, just in case, just on a risk rating, if they can't, why they can't, and how we can, kind of change that risk rating on that at all. Because what we're saying, it's great with the current amount, but if we didn't have the current amount, then that would change the picture for Rutland.
Yeah.
Well, I've got another question. Sorry, anybody else before I jump in with my? Oh yes, hang on, Debs. Go on then, Debs.
Sorry, it was just one other point I remembered. My other point I wanted to make, that obviously this is a really important piece of work, particularly in the context of the broader provision of service, provision and access to services for the local population. So the consultation that we have just completed and are awaiting the formal feedback around same-day urgent care links to the pharmacy provision of services. It links to GP provision of services, and indeed to the more complex access to services for urgent treatment centres and ED. So I think when we are at our implementation stage to the same day access service, we will be looking to do some comms with the public overall about accessing services across the range. So the more we can do to raise the profile of pharmacy available and delivered services, I think will help. But that in essence will then influence the next round of the need assessment for pharmacy services, because if we can increase usage, then of course it might push us to a future issue around supply of pharmacies in relation to the demand we're enticing, if that makes sense.
Right, thank you. I've got 3, Amy, of course, and they're all very similar to other people have said. So my 3, 1, this might be David. I don't understand military, and I've just realised that I don't understand. I thought those in the military got healthcare, and the families, etc., had to use local healthcare. Have I got that wrong?
No, you've got it absolutely right.
I thought I had. So that's an issue, isn't it? That we are, because even Kendrew, they are quite isolated. They're a long way from the nearest pharmacy. Amy's looking at me going, oh no, I hate her. Ali, do you want to, oh no, Deborah, do you want to respond to that one, Debs, first?
No, I'm so sorry. I butted in before
there.
you asked
Yeah.
me, so my hand can come down.
Ali, sorry.
Yeah, I mean, yes, I guess if they haven't got the transport, but from experience, most of them are registered either at Empingham or Market Overton, which do have dispensing pharmacists.
Right. Okay, thank you for that.
Yeah,
but it's just I just feel they're quite isolated up there. My second comment was needle exchange. Do we not have any drug addicts in Rutland? Anyone know? I'm surprised we haven't got a needle exchange service.
There are service users in Rutland, but there
Yeah.
isn't currently a needle exchange in Rutland.
Oh, I thought on that it said there wasn't a service.
No, there isn't. There is a substance misuse service, but there is not a needle exchange.
Okay. So
it used to be with Boots, but they pulled out of the contract, and we've not been able to link with.
Right.
Any of the other pharmacies are reluctant to offer the service.
Because that's my last question. Does this then, Adrian, you may be able to answer this, but does this, all this lovely work, and it is very good, and Amy, don't take it personally, I've just always got questions. Does this go into an action plan, which is what Debs was talking about improving access and availability of services? Is that part of the process, part of the rationale for this, I suppose, is what I'm saying?
So there are a set of recommendations in the report, and they are to move the recommendations are there to make things better for residents, but ultimately we don't have any control over what pharmacies want or don't want to deliver. A
bit like GPs, we've got the same. Debs, go on.
So just to add to that, it is actually the role of the Health and Wellbeing Board itself to respond to look at the outcomes of these reports, look at the needs, and to see if there are significant risks or gaps, and for us to examine, are there ways that we can fulfill them? And because we can't always, but yeah, so it's not we would all use and assess the output of these needs assessment in order to work out, for example, is there something that we could add into our health and wellbeing strategy or action plans to address them, or is there a way that, and it might be that we can't address them locally, but what we do need to do is to make sure that residents know where they can access services, because everybody will need to access a service. They might not always be able to access them locally.
Lovely. Thank you so much. That's exactly so. I think we've got more work to do. Simple as that. That's lovely. So I think there's I think that's, anybody else want to say, make any more comments? I'm going to turn to Jane for advice now. Where are you gone, Jane? You've disappeared from my life. Jane, look at me.
I'm here. I'm always here.
I can hear you. Does this have to be a vote, or is this just a general confirmation? Do we have to vote in favour?
It does have to be a vote. There are 3 items to be voted on.
I'm with you. Recommendations 1.2, 1, 2, and 3. Right. So, is it best I read them out completely, do you think? Or shall I share that page? Not sure I could. Anyone got any preference? Jane, tell me what I'm doing, Jane.
What I can do is I can read them out, and then I can do that, yes. And then if I will read all 3,
right,
and then if we do a vote, if we do a show of hands, please, and then I will note down to make sure that it's passed or whatever. And then what will happen is, because this meeting is virtual, that agreement or decision will then be put forward to the next meeting,
to be
of the health.
ratified.
Correct.
Yeah. Okay.
Correct.
Okay. So over to Jane. Thank you very much, Jane.
So the recommendations are that the committee has noted the work undertaken to produce the draft pharmaceutical needs assessment 2025, which had included consultation with Rutland residents and pharmacy professionals on their views of local pharmacy provision, and that the committee has approved the draft P&A for the statutory consultation process, subject to any suggested comments / amendments, and that the committee has noted that a further report will be considered by the board at its meeting in September 2025, detailing the outcome of the statutory consultation and seeking approval to publish the final P&A for 2025. All those in favour, can I have a show of hands, please? Right. David, thank you. Janet. Ian, thank you. It makes it slightly a bit tricky with it being virtual. There we go. Excuse me. Thank you. Deborah and Emma. There we go. Take you. Councillor Smith. I'll just go on to the next page because we have several attendees, and I think that is everybody. Thank you.
Tim and me, lovely. Thank you very much. And so, right, so we've noted the recommendations. So that
Councillor Ellison, sorry, you're reading it out. Just a quick question, Jane, a constitutional one. So members who are representing other members, do under our constitution, do they vote or not? You're on mute, Jane.
That was
story of my life. Right. Yes, in answer to that, Deborah, yes, they do have the right to vote because they are attending as a representative, so they do have voting rights. So are you referring to Joanne?
I am. Not to put you on the spot, Joe.
But yes, if she's, yes, lovely. Yeah, thank you.
Jane, can you put me down for Mike as well, please?
Will do. Thank you. Yes, that's okay. That's everybody.
Nobody wants to be anybody else tonight. I'm going to be. Right. So we have covered everything. We've looked at the options. We looked at the background. I'm just going whizzing through the content and the consultation process. Financial implications. We probably should have mentioned this, shouldn't we? There are, from existing service budgets, legal implications. There are no additional ones, but it could also be part of our legal challenge. That's quite interesting. Data implications, equality, etc. And I don't think there's anything else that's specific unless we come down to 3.6.1. We have the Health and Wellbeing Board, as we heard, has a statutory responsibility to prepare and publish the P&A for Rutland. So that's the one that Jane was talking about, which will come to be ratified at the next meeting. Are there anything else that we need to talk about? Anybody else got any comments? No, that's lovely. I quite like ones like this. Thank you very much, everybody. Have a lovely afternoon and goodbye. Stop smiling at me, Jane.
Thank you.
Thanks, everybody.
Thank you.
Bye-bye, everybody.